Hello and welcome to the Plant Paradigm Podcast, where we have inspiring conversations with individuals from all around the world and look for ways to create a clean, green, and sustainable future for us, the planet, and all beings. I'm your host, Tom Simak, a fellow plant eater who strives to optimize every living ecosystem, passionate about looking after this beautiful planet we call home and all the lovely creatures that dwell among it. Before I get into today's conversation, I just want to remind you guys that visual snippets of this show and other resources that I create are put up on our Instagram at plant.paradigm. We also have a TikTok and a Twitter account, and all these conversations get uploaded onto YouTube. One longer one with this whole conversation, as well as snippets that you can share around. As always, I'll leave the link to that all in the show notes. In today's conversation, we are speaking with Dr. Nicole Harkin, MD. Dr. Harkin is board certified in internal medicine, cardiology, echocardiology, nuclear cardiology, and clinical lipidology. That is a mouthful, and I'm stoked that I pronounced all those right. She founded Whole Heart Cardiology with the mission of providing patient-centered cardiac care, evidence-based nutritional guidance, and personalised lifestyle plans. Nicole is a great example of what we need more of. Doctors that follow and prescribe based on today's scientific evidence, which in many cases points to a plant-centric or plant-predominant diet in order to foster healthy physiology. And that's a lot of what we'll actually be talking about. Healthy ways to eat, how to avoid heart disease, body compositions, reading labels, and diving into so many definitions like what even is a healthy heart? What does that look like? I'm sure you will enjoy this conversation. Nicole is a wealth of knowledge, and I will see you guys on the other side. Dr. Nicole Harkin, welcome to the Plant Paradigm Podcast. How are you going?
I'm good. Thank you so much. I'm so excited to be here. Thanks for having me on.
Absolute pleasure. Look, in all honesty, when I was doing my preparation for this episode, I've noticed something that you've got an insane amount of experience across so many different areas. I mean, cardiology, echocardiography, clinical lipidology. I don't even know how to pronounce some of these things. Where does your thirst for knowledge even come from?
Oh my goodness, that's a really good question. I'm definitely not one of those kids that knew they wanted to be a doctor when I was little. It sort of just kind of happened. I've always been interested in kind of science and scientific inquiry and the human body, and obviously, helping people and things like that. And so it sort of just evolved, and I really loved like my biology classes. And then eventually, just one day, I was like, I'm going to be a doctor. So that journey was long and arduous, but I really was just so happy to have found my path, which was helping people prevent heart disease. And I just wanted to have all of those tools that I needed to do that, which meant kind of going further into learning about cholesterol, which I'm sure we'll talk about as it's one of the most important causes of heart disease. So really wanted to kind of learn more about that and how to treat that. And then just got really deep into kind of preventive cardiology and all the different tools and tests that we need to learn how to diagnose and then treat heart disease.
I love that. I mean, I'm going to follow that up with another pretty difficult question. In your years of experience, like reading papers, being actually connected to the client and having that relationship there and the whole dynamic that you've had, what's like the most or some of the most insane or mind-blowing facts about heart health that you've learned?
I mean, I think probably one of the craziest facts that just never ceases to blow my mind is that 80% of heart disease is preventable. And I think that's just a really important number, given that it's the number one cause of death in both men and women across the globe. And so the fact that we have this ability to prevent 80% of it, if we could only figure out how to kind of implement the most healthful lifestyle changes, is just really powerful to me. And I think that like everyone needs to know that. And it's not to downplay genetics and environment and all of these other things. They are important. And as a cardiologist, I see, and as a lipidologist, I see them every day. But the fact that we can help so many people with some of these lifestyle changes that aren't simple. Don't get me wrong. It's not just, snap your fingers and everything's better. It requires a lot of hard work and behavioral change and all kinds of stuff. But the fact that we can prevent a lot of this pain and suffering and death with these things that don't even involve medications is just staggering to me.
I mean, it's also like the best thing because a lot of the time we have to just bring it back to basics, and that helps so much. Like, it would be really awkward and devastating if we've got this number one killer and we're just like, oh crap, we don't know what to do with it. Like, we don't have a solution in mind. Whereas we have this amazing, beautiful thing called plants that can help us do so many things. So
absolutely,
I absolutely want to dive into the environment and cholesterol and all those things. But firstly, I want to get some definitions down pat. Can you define what a healthy heart even is?
That's a great question. So a healthy heart is a heart that can pump blood to the rest of the body. It is the heart is the body's engine, if you will, and it's responsible for delivering our blood, which carries energy and all kinds of things that we need throughout our body. So having a strong heart is really important to be able to accomplish that. And it's a muscle, and just like any other muscle, it can get overused because of, say, like high blood pressure. Or it can expand and heart failure and not work as well. So that's sort of a healthy heart. And then inside the heart, we have valves, and those are really important for keeping the blood where it's supposed to be during the cardiac cycle and not where it's supposed to be when it's not in the cardiac cycle. And those can get old or floppy or thickened. So those need to be working properly. The heart also has an electrical conduction system. And so that electricity is responsible for the timing of the heartbeat and telling the heartbeat to beat when it's supposed to beat. And so that has to be working properly. It can go too fast or too slow. And then lastly, the heart has a blood supply to itself. Those are called the coronary arteries. And typically, I think when most people think of heart disease, that's what they think about, is that those arteries to the heart get blocked with plaque or cholesterol buildup, and that's when heart attacks occur. And that's important because that's another very common cause of the heart pump not functioning very well, is once you've had a heart attack, it doesn't receive blood, and then that part of the heart dies off.
I mean, what you're kind of saying is amazing, and it rings true to this saying that we are truly like the most advanced technology on this planet. Like, that is just so intricate, and the fact that you've wrapped your head around that is absolutely impressive. But obviously we can't, as people, just rip our heart out and just be like, oh yeah, the valve looks good here and the blood's pumping properly. Like, we can't just have a look into that without like some pretty insane technology looking at it. So what does, or in terms of like physically looking, like what a person institutes or how a person walks around, what would be a healthy or an unhealthy heart? Is there symptoms from the outside that can dictate that?
Yeah, absolutely. So I think first it's important to highlight that, unfortunately, a heart disease is often difficult to detect until it becomes more advanced. So if you have sort of small blockages in your arteries, or the early stages of blockages, if they are not obstructing the heart blood vessel very much, you won't know that they're there. It's only once they start to obstruct that blood vessel by about 70% or so that the heart starts to not receive enough blood. And that's when people start to develop symptoms. The most common symptoms of having blockages in your heart is typically chest pain, although that can be not kind of the standard crushing chest pain that you see in the movies. It can be very subtle. It can also be in the neck or the back, or more in the upper belly area. People also can get shortness of breath, or just sort of nausea, or general feelings of being unwell. So those are some of the more common symptoms that we see when people are starting to get blockages in their heart. And that can either present as sort of a gradual onset, particularly when you're trying to do exercise, like climbing upstairs, or it can present sort of more dramatically as a heart attack, which is when that vessel gets blocked off entirely.
What about on the other side of that spectrum where your heart is healthy? Like, what does that look like? Do you get like, some people like really chipper and happy all the time? Does that mean they have a healthy heart? Or maybe when an athlete can just run insane distances or lift insane weights, does that mean they have a healthy heart? What does that look like?
Yeah, so a healthy heart can be different for every person. Men and women have different sizes. Different sized people have different sizes of hearts and functions of hearts. There's a wide range of sort of that what we consider normal. But there's certain things that we look for to figure out if someone has a healthy heart, and you reference one of them, which is your ability to perform exercise. So people that can do a good amount of exercise without having any symptoms that's a good sign that their heart is working well, and they're able to do what they need to do. Other things that we can kind of look at, obviously, I'm sure we can get into all the different testing and things like that, but there's certain signs of a healthy heart that just you can look for yourself, which is something like a lower resting heart rate is typically a sign of good cardiorespiratory fitness and typically a healthier heart. Also things like heart rate variability, which is starting to get more common in terms of some of our smartwatches and things like that. So having a higher HRV is a sign of a healthier heart. So there's things like that we can also look at that are sort of external cues that tell us that things are probably working properly.
I love that. And look, let's dig into the exercise part of things, because I want to get some definition down pat again. But in terms of like heart health for an athlete, we have different measurements like VO2 max, the lower resting heart rate, which you said, greater efficiency, higher red blood cell count. All of these things make a big difference. Is exercise, and like how strenuous do you have to exercise to achieve a benefit? Like, is there like a 20-minute a day, I guess, rule of thumb, or an hour a day, or an hour of low intensity and then 20 minutes of high intensity? Like, is there a rule of thumb to achieve, I guess, what's imposed now is like a good, healthy heart routine?
Yeah, so that's a great question. So when we've looked at large populations and how much they exercise or how little they exercise, we know that large quantities of regular exercise is beneficial for heart health. So the American Heart Association recommends about 150 minutes of moderate intensity exercise a week. And when they've looked at how you split that up, you can sort of do it however you want to. And people seem to achieve the same benefit. For people who are really looking to optimize their heart health, we really see continued, although less dramatic, benefit up to about 300 minutes of moderate intensity exercise a week. Beyond that, we don't see much benefit. And in fact, on some of the really higher ends of that, we may see a little bit of harm, although that's debatable. So definitely somewhere in that 150 to 300 minutes of moderate intensity exercise a week. In terms of the type of exercise, any sort of aerobic activity is great. Although there is some indication that some of the interval training or HIIT type work may be more beneficial as well. So if that's something you enjoy, that's a great thing to do. The other component of it is actually avoiding being sedentary. So somewhat independent of your level of exercise, also just not sitting around at our desk like we're doing for very extended periods of time is a good idea. So once you see people kind of like sitting at a job at a desk for about 8 to 10 hours at a time, you see increased risk of cardiovascular mortality and all-cause mortality. And that's fairly independent of getting enough exercise. So it's not just enough to kind of like get all those exercise minutes in when you can, but still sit around. So I do encourage my patients to, if they do have a desk job, try to get up as much as you can frequently, take a call while pacing or walking, or, come up with creative ways, standing desk, things like that. So those are also important things to keep in mind when you're thinking about your body and its activity for optimal heart health.
I love that. And I want to circle back to a lot of this later on, but I want to touch on something that I'm sure we both love, which is food. Look, I'm definitely an avid foodie and I love eating it more than cooking it, but My question for you is, what are some of the foods that we can include in our weekly lists or our grocery shop that are extremely beneficial to the heart? Like I hear things like eat red foods for the heart, like beetroot or tomato. Like is there some merit to that, or is there certain foods that we should definitely stick to?
Yeah, so as I'm sure most of your listeners are aware, plants in general are an excellent choice for heart health. So dietary patterns that emphasize an abundance of fruits, vegetables, whole grains, beans, nuts, and seeds have really been associated in study after study to be associated with a lower risk of heart disease. Now, in terms of like specific foods that may be beneficial for the heart above and beyond just kind of plants in general. There's definitely some food groups that have emerged as particularly heart healthy. We think of things like berries for their antioxidants, green leafy vegetables, which are seem to be good for kind of blood pressure lowering and other heart outcomes. And then kind of legumes, which are just really high in plant proteins and fibers and things like that. So there are some plants that seem to be really, if you're looking to optimize your heart health, you want to make sure you kind of get those on your grocery list and try to have those on a weekly basis. But you know, I try not to be too reductionist about it either. I think as long as people are really focusing on kind of a wide variety of all of these healthful foods and limiting or completely eliminating all of the unhealthy foods, you know, try not to get it too complicated is also important.
I love that. Now, you mentioned two things I actually want to dive into a little bit. You mentioned antioxidants and you mentioned fiber. Now, these are things that are very abundant in plenty of plant foods. Can we start with antioxidant? What exactly is that and what does it do in the body?
Yeah, so there's this interesting concept about antioxidants, and we do know that there's a really important balance, right, between inflammation and oxidation, and our ability to sort of process all of those and respond to those things. So antioxidant ingestion in lots and lots of studies has been associated with improved health outcomes. And that's because the negative effects of cholesterol getting deposited in the arteries of the heart, what happens is it gets oxidized. And that's actually when it becomes toxic to the blood vessel wall and initiates this massive inflammatory cascade. And so the idea is that we can sort of suppress some of that oxidative process, then maybe we wouldn't have these outcomes like heart attack and things like that, which are inflammatory disorders as well as just being cholesterol disorders. But what we've sort of seen is that while ingestion of food containing antioxidants is really beneficial for heart health, taking it in larger quantities like supplement form doesn't lead to improved heart health outcomes. And that is probably because of this push-pull in our body between having kind of that right balance.
I agree. That's awesome. And I wonder if it's sometimes the reductionist form of the concept of supplements. Like you try to find this magic pill, this one part of like a blueberry that just has the antioxidant, not knowing that the blueberry also has fiber and plenty of other vitamins that potentially work together in the body to create something completely different.
Absolutely.
Now let's go to fiber. All plants, to my understanding, have fiber. What exactly is it and how does that affect the body?
Yeah, so fiber is something that no one in the United States consumes nearly enough of. And as you said, it's contained in plants. It's not contained in animal products. And we're all basically fiber deficient at this point. So it's indigestible. Oh my gosh, you're going to edit that part out, right? I can't talk. Indigestible. Wow, I'm having issues there. So essentially what happens is it is it goes into our intestine when we consume it. And rather than, and it can either be kind of food for our microbiome, or what happens actually is it's fantastic at, so soluble fiber in particular is the fiber. Both fibers are great, but soluble fiber is the one I focus on because that is what's shown to have improved cardiovascular outcomes from lowering LDL cholesterol. So what happens is that it slows transit within the intestine and then also can bind to what's called bile salts. And those are made from cholesterol from our body. So stick with me here. So what that does by binding the bile salts and then we poop them out, your body has to make more. And how does it make more? By pulling cholesterol, right? So we can lower our LDL cholesterol, the bad cholesterol, quite powerfully with large intakes of fiber. And so there's actually something called the portfolio diet, which has been well studied. And it's a component of 4 different food groups, but fiber, particularly soluble fiber, being a very important component of it. And these 4 components together have been shown to lower cholesterol by about as much as kind of a low potency statin. And so the amount of fiber that is in that diet is about 20 grams of soluble fiber. And as you said, it's found in abundance in plant foods. Some have more insoluble, some have more soluble, but most have kind of a mixture of it. And so consuming lots of fiber is good for digestion, and then it's also really good for lowering cholesterol, and in lots of studies has been associated with lower risk of all-cause mortality.
I love that. So the point of the story, it does more than just help you poop.
Exactly.
Essentially. Look, when you're in the shopping center and you're doing your grocery haul, we probably spend, I'm sure I do and a lot of the listeners do, we spend about 20% of the time walking and then 80% of the time reading labels if we're not shopping for fruit and veg. What are some ingredients that we should look out for that are potentially quite harmful, or on the other side, actually not as bad as you might think?
Yeah, that's a great one. So nutritional, so as you said, the bulk of what we're shopping for should hopefully not have a nutritional label on it because it's our whole foods. But obviously we all live in the real world and we need some convenience foods. So things that you're looking out for to try to avoid particularly from a heart health perspective are things like saturated fat. So saturated fat is mostly found in animal products. So if you're avoiding animal products, your chances are pretty good of having a decently low saturated fat intake. But it can be found in things like coconut oil. So be careful with some of sort of the cheese, the plant-based cheeses and things like that. And while it's controversial how much coconut oil, because of the specific type of saturated fat it is, that it increases LDL cholesterol, it does appear to do so in many patients. So if cholesterol is an issue, just try not to consume large quantities of that. And the reason saturated fat is important to avoid is because it is in most people, the number one thing that can raise cholesterol in our body, the LDL cholesterol. So that's an easy one to try to avoid. And if you're, as I said, if you're sticking to mostly plants, just be a lookout for some of the plant-based cheeses and otherwise you should be good to go. And then trans fat is the other one to really avoid. It's we don't have to spend too much time talking about it because it's mostly getting phased out, thankfully, as of January 2021. So you hopefully will not find that in the grocery stores anymore. But essentially, it does like everything bad in your body that you don't want to have happen. It raises your LDL, it lowers your HDL. It's just bad news. And thankfully, we've come to our senses, and that should not be available. But typically, you would find it in kind of like margarines and things like that. And then sugar, added sugars. Those are kind of the last one that I would highlight as to things that you want to try to avoid. We talk a lot about the difference between sort of natural sugars, meaning the sugars that you find in whole fruits and things like that versus added sugars. And we could do an entire podcast episode about the issues with added sugars. But essentially they are strongly linked to insulin resistance, glucose intolerance, diabetes, things like that, weight gain. So really just looking at some of those added sugars. And you can see them in all kinds of products, flavored yogurts, like all kinds of stuff. So just being mindful of how much extra sugar you're taking in is really important.
I love that. Now, I want to touch on the fruit thing for a second because I've never fallen into that trap, I don't think, but I know a lot of my friends and some family members are actually quite scared of fruit because of this misguided concept of sugar. Can you kind of explain why that is not the case in a way that we can then forward that message onto people who might like be like, oh no, I'm on a diet, I can't have bananas or whatever it may be?
Yeah. So, and I think, the story is probably like everything in nutritional science, a little bit more complicated than, this is all good or all bad, right?
Mm.
So fruits certainly have sugar in them, but they also have a lot of fiber. And so that fiber helps to modulate that glucose response. So when you consume a whole fruit that also has the fiber, your body does not process and absorb nearly as much sugar as if you had a lollipop. So we inherently know those are two different things, but they really are two different things when your body is kind of processing them. Now, some of that we may have some genetic and microbiotal differences in terms of how we respond to different inputs, such as sugar or fat or things like that. So there may be a world in which at some point there's somewhat of a personalized approach to that. But when we look at populations as a whole, fruits are very, very helpful. And in general, if you're avoiding refined grains like white breads, white rice, all of those sort of things that are devoid of the fiber, those are much more responsible for, glucose spikes and diabetes and insulin resistance and all of that other kind of stuff.
Okay, I love it. Do you have now? We've done our shopping. We've got our cart full of veggies and fruits and other things. We get home. What's something, one or two meals that you're cooking up for your family that are just an abundance of nutrients and health?
Ooh, where do I even start?
Dealer's choice.
I know. I'm trying to think of what would be my favorite. So I think for me, two things that stand out. So I love grain bowls. I could probably, my husband probably would not be on board with this, but I would eat them almost every meal if I could. So I love doing a great grain bowl because I think you can get in so much fiber and plant protein in them, and you can and they're simple. And I've got 3 kids, so I don't have a lot of time to meal plan, and it's just something I know to do. So I think aiming for some amount of, I like to use quinoa or wild rice or whatever. Pick your grain, mix it up. They all have different, this one's higher in protein, whatever else. Just pick your grain and then just kind of vary it up. And then I like to include some sort of sauteed greens like kale or something like that, and then just roast some veggies and do a pan sort of dish, and some baked chickpeas as well for some extra protein. And then I love a simple tahini sauce on top. And that's kind of my go-to. I probably have that at least once a week. And you want to just kind of really eat the rainbow. It's totally cheesy. But again, that goes back to looking for increased variety in your plant foods. And that helps you sort of hit the different vitamins, hit the different kind of micronutrients, and not having to worry too much about, oh my goodness, did I get enough, vitamin C today or something like that, as long as you're just eating a lot of variety. So I think a grain bowl is a great quick way to do that, that doesn't require a lot of planning, and you really just get a lot of protein and fiber that way. And then I think the second dish, if I had to pick, would be a lentil bolognese, only because it tastes like my childhood, except previously it was with ground beef, and now I make it with lentils, and I love it. So cooked tomatoes, lycopene, all this deliciousness, and then the lentils are great for the protein and the fiber. And then I do serve it over a chickpea pasta. Again, that's another great swap that you can make from a white pasta to sort of either a bean or a whole wheat pasta. The bean ones are great because you get again more plant protein. And the kids love it. I love it. So that's another favorite.
I love it. We've, I think, permanently at this stage switched to zucchini pasta. It's just the go. I think what you mentioned before as well, eat the rainbow, it does sound super corny and I totally get it, but there's actually reasons that we say it. And correct me if I'm wrong, but I learned from Will Bushowitz from Fiber Fueled that certain foods, when paired together, actually make a much more of almost like a vitamin blend that increase the absorption or increase the amount, such as black pepper and turmeric. I believe the amount of curcumin absorbed is like 1,000 times more. Am I on the right track with that?
Yeah, exactly. Yeah, there is some interesting info coming out about different food combinations and things like that. And so I think that kind of stuff can be really interesting, right? Or, pairing vitamin C with your greens for iron, or, there's different sort of food pairings that can be really beneficial. And also kind of interesting to highlight that, I think there is this perceived notion that that all raw foods are the way to go. You get more minerals and nutrients that way. But actually cooking certain foods like tomatoes, for instance, increases their bioavailability, right? So I think, again, not, focusing too much on getting I mean, some people really want to get very hyper-focused on that. And I'm happy to do that with my patients. But I think as long as you focus on kind of wide variety of cooking styles, wide variety of foods, just really trying to focus on variety is a good way to kind of get all those things in without getting too caught up in all the tiny details.
I love it. Before I get into the juiciness of what I wanted to talk about today, I want to know how you, as a cardiologist, someone working in the field, how do you stay up to date with the science? Because I'm sure some do a lot better jobs than others and vice versa. But what is your method of making sure that you're actually delivering the most genuine, authentic, agenda-free data?
I think that's a really, really good point. And as you well know, nutritional science in particular is really difficult to, one, as you alluded to, find sort of unbiased without agenda in terms of how it's presented for many, many people. And it's also just really difficult to do. Unlike studying, say, a medication where you can very easily do what's called a randomized controlled trial, which is give one group the drug or a supplement, the other group not, and then compare them. And then they're a very, you purposely pick them into very similar groups. So you can be very confident that it's your intervention that's the result of this. Food is just so much more difficult to study, right? Because we all have to eat food. There's no not eating food. And so anytime you're studying one nutritional pattern or food group, you have to then replace it with something else. So it's always all about what are you comparing it to? So I think it's really important to pay attention not only to the science that's coming out, but where is it coming from, and what is it? How does it kind of fit into the greater literature as a whole? So I think as doctors and nutritionists and anyone else that's in the health profession, it's really important just to continually learn and keep an open mind, and not get too focused on sort of how you see it playing out. And I think any good scientist will always say that that if the science proves that they're wrong, then they'll have to admit that they were wrong, right? So I think it's really important to just kind of really continually learn and read. So just staying up to date with the different journals that come out with papers. JACC is the big one for cardiology, but there's a million. And then interacting with other people that are also sort of learning and reading and processing. So I think all of that is really important. But you're right, it can get daunting because new information comes out all of the time. So it's really important to kind of continually reevaluate based on new information, what you're doing and then how to move forward.
And it's hard as a consumer. I can only imagine it would be just as difficult as someone working in the health field because you've got the added pressure of, well, I'm talking to hundreds and sometimes thousands of people. So I need to make sure I'm on a roll.
And absolutely, no, you definitely want to make sure that you're presenting that information in a way that that is the truth as you know it. And I think it's just really important to be honest that this is the information that we have now, and this is what we know and this is what we don't know. And I think a lot of times, anytime you're reading something and people are sort of like, this is the only way, and this is definitively what things show, and there's no room for any sort of further questions or probing, then be very wary of that person. You want to be looking to get your nutritional science information or any science information from someone who is doing their best to present it as unbiased as possible, and is willing to sort of describe what are the unknowns now, because there's always unknowns.
Totally agree. So let's get to the juicy part I was mentioning before. Red meat, dairy, eggs. How do these animal products affect the heart?
I like how you described this, the juicy part. I've been like waiting with bated breath. What's the juicy question? I love it. So there's a lot of different nutritional studies that epidemiologic studies that have sort of looked at these different products in terms of how they compare by doing different kind of swaps and things like that. So by and large, red meat, particularly processed red meat, tends to get sort of the worst rating, if you will, in terms of heart health effects. Universally, it's demonstrated to have an increased risk of heart disease, pretty much when you're comparing it to really anything else, certainly plants. And typically even kind of white meat and all these other things. Eggs don't tend to perform very well either. Dairy is a little bit of a mixed picture, and we can get into that. So the main reason that most of these animal products are likely detrimental to the heart, number one, saturated fat, which we've touched on as well. But all of them are very high in saturated fat, which is again consistently shown to increase risk of heart disease by contributing to LDL elevations, which again are consistently associated with increased risk. So that's a big one. Cholesterol, they also tend to have cholesterol, and that is less important in terms of our body cholesterol. It's kind of confusing, but we don't tend to increase our cholesterol as much in response to dietary cholesterol, although in some susceptible individuals it does. And then also it's important to note that they tend to lack the things that are associated with healthful outcomes, such as some of the things we've talked about, like fiber. So some of it is what they have in them, which is the saturated fat, the cholesterol, and then some of the more novel things that we're looking at, like carnitine, which turns into TMAO, and all of these heme iron. So there's all these other compounds that we're starting to learn more and more about that may also contribute to their unhealthy effects. And then some of it's also the foods that they displace, right? So instead of eating lentils, you're eating red meat. And so not only are you getting the saturated fat and cholesterol and heme iron and all the other stuff, but you're not getting the benefits of the lentils, which is the fiber and all of that kind of stuff.
I noticed something a little bit interesting while you were explaining that. And I'd be lying if I said I haven't noticed it in a lot of people, especially when it comes to the health field and the medical profession. You tend to lean towards terminology such as likely or associated. Why is it that we can't say, or will we ever be able to definitively say, red meat causes X, or lentils even cause X in terms of a positive effect too? It can work both ways. Why do you tend to veer away from those kinds of terminologies?
Yeah, so this goes back to what I was saying about really being transparent and honest about the scientific data that we have and what it shows. So unfortunately, because of the very nature of food and what we consume, as I said before, it's difficult to conduct long-term randomized controlled trials. It's been done. Like PrediMed is a very good example. So for your listeners, that's a randomized controlled trial that was done a number of years ago that looked at the Mediterranean diet. And that was a long-term randomized controlled trial. And it did show that the Mediterranean diet was supplemented with extra virgin olive oil or nuts was associated with a reduced risk of heart disease, about 30%. It was very dramatic. So it's possible, but it's very difficult, right? And so what we're typically left with is either short-term randomized controlled trials, which means we're looking at, on the order of weeks to months. How does that affect the participants? And you can't look at heart disease outcomes, obviously. You can look at surrogates. So you can look at how does that affect your cholesterol, or how does that affect your glucose intolerance, or whatever else. And those are important. But in those studies, you can't then show mortality or heart attack or whatever else. So then the other types of main trials that we have are epidemiologic studies, which are really important, particularly when they are large, they're well done, and they control for different confounding variables, which basically means residual differences between people. But it's not as controlled of an environment, right? And so you're looking, because you're not actively choosing an intervention, you can't definitively say this causes this. You say it's associated with, because that is the observation. And, that becomes quite powerful when you see that over and over again in large populations, time and time again. And as I said, done in really well done ways where you've controlled for everything else. So that's sort of some of the limitations of nutritional science.
Thanks for running me through that. Look, on the other side of things, we touched on the meat, and now we've got the new meat, or I guess the latest technology in terms of meat, which is like your Beyond Meat, Impossible Burgers. Looking at what this contains nutritionally, like it tends to be pretty good compared to red meat in terms of the complete reduction of LDL, a lot less saturated fat. However, I have noticed that it has got much higher sodium. Almost double, in fact. So sodium we have in a lot of things, and you can maybe explain the difference between sodium in foods and potentially like table salt or iodized salt. But what foods have really high sodium, and is that something that we should be quite worried about?
Yeah, so that is a really great question. I'm glad you brought that up, because in my list of things that I told people to look out for on the nutritional label, I completely failed to mention salt. So that's a great one. So sodium is a really important one to look at. And we know that sodium is important because actually one of the other few randomized controlled trials we have with diet is one that involved reductions in sodium content and looking at blood pressure. And that's called the DASH diet. Essentially, it's kind of a plant predominant sort of diet. And then the other part of the diet was to dramatically reduce sodium. And we see really nice, robust reductions in blood pressure when individuals limit their salt intake, ideally below kind of 1,500 milligrams a day. And so that is important, because blood pressure, aside from cholesterol, is the other major risk factor for both heart disease and stroke. And so added sodium is definitely another sort of ingredient of concern that you should just be mindful of and look out for. And then in terms of kind of these fake meats, or whatever you want to call them, I would just highlight that that you're exactly correct. They have, when you compare them head to head with kind of red meat, they look not so bad. Definitely sodium, but they have more fiber. They have some saturated fat for sure as well, and they definitely fall into that sort of category of being ultra processed. So while we do have some short-term data showing that surprisingly, they do, compared to sort of red meat, they do lower LDL cholesterol because they have the fiber, which we've talked a lot about. But they are probably not as good of a choice as, say, a homemade black bean burger or something along those lines. More of a kind of a whole food approach. So kind of on the continuum, I would say that it's definitely better than red meat. So for my red meat eaters, I would say that that's a very reasonable switch. And then, there's obviously other reasons, environmental and such. But for plant-based eaters, I encourage kind of the more whole food plant-based approach when possible. And then just treating kind of these fake meat burgers as treats or things to enjoy kind of socially or what have you.
Thanks for breaking that down. Now, I want to join two things that you've mentioned before in this chat, and I want to make one question out of them. First, you mentioned that the heart is the engine of the body. It is incredibly vital for our health, obviously. And the second part is that cardiovascular health, one factor is also genetics. So I want to know, does everyone have a chance to live a healthy life in terms of their heart health, even irrelevant to their genetic predisposition, if they played their card right?
That's a great question. So again, as we said, a very large percentage of heart disease is preventable. But I also do not want to minimize sort of genetic risk either, because there are, as a cholesterol specialist, I take care of patients who have genetically elevated cholesterol, who are at much higher risk of cardiovascular disease, and we know this from studies of individuals who are very similar. So, for instance, patients who have an LDL cholesterol greater than 190 milligrams per deciliter, and a strong family history, that's consistent with something called familial hyperlipidemia. And patients have a much, much higher risk of cardiovascular disease. Depending on the cause, so it's kind of a collection of different mutations that you can have that can create this sort of phenotype. Some are responsive to diet, and others, no matter what they do, perfect whole food, plant-based diet can't seem to get that cholesterol down. So for your listeners who maybe have a genetic predisposition to something, I don't want to play, that you can fix everything with the perfect diet and things like that, because I think that that's sort of it does a disservice to everyone who's working hard to improve their heart health or overall health with diet, and maybe can't seem to move the needle, or they can't get off their blood pressure medicines no matter what they do. So I see you. I like that is definitely real, and that's there. But that said, lifestyle changes can really, really dramatically improve heart health risk, and importantly, in individuals who have a genetically elevated risk of heart disease. So they've actually looked at people who, based on polygenetic risk scores, had a higher risk of heart disease than other individuals. And just by looking at them and sort of grading them into different categories based on their lifestyle choices, they found that those even at elevated risk from a genetic standpoint had a lower risk of heart disease by following kind of more heart healthy lifestyle. So definitely having a family history of heart disease, it's really important to talk to your doctor about it. It's really important to do what you can to lower your risk, but know that it is not destiny. There are things you can do, whether it's a lifestyle choices or maybe even medication to alter your risk.
Thank you for giving us that lowdown. Now, on top of that, we obviously have discussed today, fiber is great, antioxidants great. Following a whole foods plant-based diet is probably one of the best things you can do for your health. Now, I want to know if you've got any other top tips based on potentially lifestyle or dietary habits to achieve longevity.
Yeah, so I think we've talked a lot about diet and touched on exercise and things like that. I guess lastly, I would just want to touch on some of the other lifestyle changes that we can make to lower risk of heart disease. And that's some of the stuff that traditional medicine has kind of long ignored, and we're sort of finally getting around to studying it. And this is things like adequate sleep, stress levels, and how important that sort of mind, body, heart connection is, and how we can really work on modifying our risk above and beyond sort of the stuff that we know and we're working on. But some of these other things are really, truly important. And things like meditation can have, an impact on blood pressure. So it's pretty exciting, what we know. We have a lot more to learn. But I think for people who are looking to really optimize their health and their heart health, kind of starting to lean into some of these other areas can be really impactful.
I totally agree. Sleep is, I'm very passionate about it. And like, I feel like maybe it comes with age. You start to appreciate it a little bit more and you get rid of that whole I'll sleep when I die mentality, which admittedly I had when I was 18, because your body can just run on adrenaline for a little bit more. But a really good reference for people, I think, if you want to learn more about sleep, is actually Why We Sleep by Matthew Walker. I think it's a phenomenal book.
Agree.
Now we were talking before and you've got 3 kids and they're quite young. So you as a mum must be insanely busy. I want to know what you're doing raising a family that's potentially a little bit different to norm in regards to raising your kids to be as healthy as possible.
Yeah, that's a great question. So this will be more mom talking rather than doctor talking, since I'm not a pediatrician. But I think just really starting those conversations early and really getting them involved in food prep and shopping and all of that kind of stuff. And not to present things in sort of this is bad and this is good. I try to avoid those terms, but more just kind of really talking to them like I would my patients about, these types of foods can help our body grow big and strong for these reasons. And I think that's really important because studies have shown that that primordial prevention, which means preventing heart disease in children, is really where we should be focusing on our preventive efforts. And that's because heart disease does begin in childhood. They've done studies where they've looked at children and adolescents who died of other causes, and we see the early stages of heart disease in individuals who are quite young. And that's just, really scary. And so I think that if we really want to prevent heart disease, we need to be focusing on kind of a whole family approach. And for me, that involves exposing them to a wide variety of plant foods as much as possible. For me, it's actually an interesting approach because my husband isn't plant-based. And so they see a little bit of both, and they know that this is the mommy stuff and this is daddy stuff. And so it actually fosters a natural conversation of why we choose to eat different foods. And I've actually really enjoyed seeing that process as my eldest son, who's now 6, has decided that he wants to eat like I do because he doesn't want to hurt any animals. And so I think that's important for him to, one, understand why from a health reason, but then also to kind of come to that conclusion on his own. Because I think it's really important for people to kind of have the information presented to them and then sort of kind of be able to make choices for sort of more lasting, sustainable changes.
I was kind of expecting you to be like, I'll pull out a whiteboard and I run a diagram on the different valves of the heart. And this is where if you eat a carrot, it goes here and affects it in this way.
Oh, trust me, my son knows a little bit more about heart health than I think he's freaked out his teachers a couple of times by talking about LDL cholesterol and saturated fat. I mean, he knows more than the average 6-year-old, that's for sure. And there may be some diagrams in their future.
Look, I want to finish up by giving you the space to actually talk about anything you're passionate about. It could be something related to what we were talking about today, or it could be something completely random. Could be a TV show for all I want to persuade you to talk about. The space is all yours. I just wanted to give you the platform to speak your mind.
Yeah, if I watched television or had time for that, that would definitely be my top choice. Unfortunately, it's just not happening right now. No, I think that I lastly would just say in this age of kind of the pandemic era and COVID-19 and all of this craziness that is happening, I think just coming together digitally now, but hopefully at some point again in the near future, in person, and working together as as a community on some of these changes. And I really just hope that we see somewhat of a transformation in terms of how we view our health, our planetary health, and kind of coming together as a community to really move the ball forward.
I love that. And it actually completely ties perfectly into what I want to say as an ending note, which is just finishing up by thanking you so much for being an active public figure in the space of heart health and longevity, spreading free, genuine, authentic, agenda-free information. I really appreciate it because you stand out above the noise and confusion of marketing budgets and stay true to your core values, which is awesome to see, especially on social media, which in turn helps individuals and spread information like this to make sure we can become the healthiest versions of ourselves. And that obviously affects longevity of us, but also the planet and the ecosystem at large, which is awesome. So I appreciate it. I notice it. And thank you once again for joining us today for this conversation and educating us.
Thank you so much. I really enjoyed being here.
Hi there. Welcome to the end of the episode. Thank you so much for listening the whole way through. I really appreciate it. There was so much goodness in there. I really love just the basic definitions of like fiber and what even is a healthy heart. It really puts into perspective what we're looking at when we eat healthy, what's actually happening inside our body. We want that blood in there to be pumping as effectively as possible. And when we're talking to people about fiber, they might ask, why do we even care about fiber? And the way she so eloquently explained it, I think I'll probably memorize in order to further that conversation with a lot of people that are, say, anti-vegan or very pro-carnivore diet. That's a very important point to bring home in order to explain why the science actually isn't there to support those diets. Thank you once again, Nicole, for coming on and sharing your wisdom. I really appreciate it. If you want to connect with her, of course, I'll leave all the links in the show notes. Highly recommend following her on Instagram. She does post amazing resources. And while you're there, you can give us a follow too at plant.paradigm, where we'll also post snippets of conversations like these. One of the best ways you can help out this show is by sharing this conversation to a friend, family member, or colleague who you think will benefit from the resources and the information we discussed. But that is all from me today. Until next week, stay happy, eat plants, peace.